Bismillahirrahmanirrahim. Today I would like to share the knowledge about the description of ant amoeba histolytica. My name is Sarfraz Rahman. I am a PhD scholar in the Department of Parasitology. I would like to share this knowledge with references these books: Veterinary Parasitology 2nd edition by G.M. Urquhart, Veterinary Parasitology 4th edition by M.A. Taylor, George's Parasitology for Veterinarians 10th edition by D. White, D. Bowman, and last one is Internet Sources. Please subscribe my channel and also push the button of bell icon. Entamoeba histolytica. The subphylum is Sarcomastigophora, class Sarcodina. In the organisms moved by pseudopodia. Species Entamoeba histolytica, and the synonym word is Entamoeba dysentery. Histolytica. The word histolysis literally means disintegration and dissolution of organic tissues. Amoeba, a single-celled animal that catches food and moves by extended finger-like projection of protoplasm called pseudopodia. Description and about the Entamoeba histolytica. Host man, infective stage, the cyst containing 4 nucleus. Clinical sign, amoebic dysentery. Distribution worldwide. Excitation. What means excitation? This is the one metacyst. It divided by binary fission and changes into 8 metacystic trophozoites. That is called the excitation. Transmission, the fecal oral route, anal oral sexual practices, male homosexual. Reason why it is called histolytica. During growth of Entamoeba histolytica produces histolysine, mean it causes destruction and necrosis of tissues, causes flask-shaped ulcer. The life cycle of Entamoeba histolytica, pre-patent period or intermittent period, IP period, that is the 2 to 4 week, and distribution worldwide. The final host is the man, and this organism moves with excreted with the help of feces, and in the feces it changes the oocyst into cyst, and this cyst is contaminated feed and water, and this feed and water, when man eats, it causes the amoebiasis. During the life cycle stages in man, the trophozoites in colon, it changes into precyst, then precyst into cyst, then passed into the feces and contaminated the food and water. Then the cyst ingested the metacyst in small intestine, especially the ileum, and this metacystic trophozoites, especially in cecum, then it changes into the trophozoites in colon. Important points: trophozoites divides by binary fission. IP period, that is 1 to 4 week in case of intestinal amoebiasis, and IP that is 1 to 3 month in case of extraintestinal amoebiasis. Amoeboid motility is like crawling or gliding. Cystic stages: early cysts, binucleate cyst, mature quadrinucleate cyst. Morphological forms: there are 3 forms: trophozoites, precyst, cyst. Trophozoites, these present in like food vacuoles, 10 to 60 micrometer in diameter, present in tissues. Precysts, 10 to 20 micrometer in diameter, no food vacuoles. Cysts, 10 to 15 micrometer in diameter, present in the lumen of colon and feces. The important points: WHO estimates that 70,000 people die every year due to amoebiasis in the world. Encystation. What is the encystation? This is the trophozoite in the feces and undigested food particles. The trophozoite changes into precyst and then mature quadrinucleate cyst in carrier man. That is called the encystation. Pseudopodon. It is formed by sudden jerky movement of cytoplasm to one side direction. Discovery. It's first discovered by Losch in 1875, presented in dysenteric feces of a patient in St. Petersburg in Russia. Treatment: the metronidazole flagyl. This is the drug of choice, 5 mg per ml. In case of an intravenous, 500 mg per 100 ml, and it inhibits the protein synthesis. Diiodohydroxyquine, 24 to 50 mg per kg per day per oral, effective against trophozoites and cyst forms. The prevention: the proper sanitation is the key to avoid the amoebiasis. Thoroughly wash hands with soap and water after using the bathroom and before handling the food. If you are traveling to the places where the infection is common, follow this regimen when preparing and eating the food. Thoroughly wash fruits and vegetables before eating. Avoid eating fruits or vegetables unless you wash and peel them yourself. Stick to boiled water and soft drinks. If you must drink water, boil it or treat it with iodine. Avoid ice cubes or fountain drinks. Avoid milk, cheese, or other unpasteurized dairy products. Avoid food sold by street vendors. Thank you so much.